set, go.
Okay. My name's Cheyenne, and my cell communication disorder is multiple sclerosis. In multiple sclerosis, T cells attack the myelin sheath, which is the protective covering around nerve cells. These nerve cells are located around the brain and the immune system. T cells are a type of white blood cells. They are also a part of the immune system. These T cells are responsible for releasing chemicals in the nervous system that cause inflammation and damage. Okay.
I love you.
I love you.
Okay.
Okay, and this is the breakdown. In the cell communication pathway, there are 3 stages for the signal transduction pathway. They are reception, transduction, and response. During the reception, the signal is detected. Transduction, this is where the signal moves into the cell and it binds to a receptor. And then you have the response, which is where the cellular response is triggered. In multiple sclerosis, there are problems in the transduction, which also leads to problems in the response. As I said in the first slide, the cell is damaged. So in like a normal cell, a healthy cell, the signal would move into the cell and it would reach the vesicles and it would go towards the transmitters, and the signal would be sent to different parts of the body that it needed to go to. But in multiple sclerosis, this does not happen. The cell is either stopped completely or it's delayed. Okay, so like in these pictures you can see, and this is a healthy cell, a healthy nerve cell. You can see the myelin sheath surrounding it, and the signal is going straight down to where it needs to go. But in this one, where the myelin sheath is damaged, the signal is stopping and it's kinked up in places it doesn't need to be. And then this one is just a little bit of a better picture of the damage to the myelin sheath. Okay. And then the breakdown occurs in the P arm, which is the short arm of chromosome 6. If you want to get more in depth with it, it's 6p21. And chromosome 6 affects protein production and immune response. Here you can see this is the short arm, and this red area is where the mutation has occurred. And then some of the symptoms are fatigue, vision problems, numbness and tingling, muscle spasms, which are involuntary contractions, weakness, stiffness of bones and muscles, mobility and mental problems, depression and anxiety, bowel problems, difficulty speaking and swallowing, sexual problems, and bladder problems. Okay. There is no specific cause of multiple sclerosis. We just have many theories to it. So some of these are, many say that T cells meet with dendritic cells and become pathogenic. It says that they become pathogenic in the lymph nodes, and signals from dendritic cells prime the T cells to trigger immune responses in other parts of the body when they are met with autoantigens, which is the body's own elements. But in like a normal healthy cell, it triggers responses on antigens and it attacks things that aren't supposed to be there. But in multiple sclerosis, it attacks things that are needed on the cell. It also says that interleukin, IL-6, plays a leading role in obstructing T cells. They say that it's like a molecular switch. It's flipped and it causes the T cells to become pathogenic. And then of course there are autoimmune disorders and environmental factors. Some of these are being exposed to a virus or low levels of vitamin D. And then you have genetic factors, which are changes in the HLA-DRB1 and IL-7R gene. And they also say that those with family members, like your mother or your grandmother or aunt, you're more likely to get it because multiple sclerosis is dominant in Caucasians and women. And then the attack on the nerve cells called plaques or lesions to form, and lesions cause many of the symptoms in MS. Some of these little white areas are the lesions and plaques on the brain. In a normal brain, you wouldn't have all of these white areas. Okay. And then there are 2 types of multiple sclerosis. One is relapsing remitting. It is the most common form of multiple sclerosis. With this type, you have a short period of time where your symptoms and your attacks are hitting you all at one time, and then you have another period of time where your symptoms are little to none. And then you have progressive relapsing. This is the least common form of multiple sclerosis. This one's where your symptoms and your attacks, they suddenly worsen and your health is on a steady downfall. Both are usually diagnosed between the ages of 20 and 40. And most people with multiple sclerosis do not necessarily pass from the disease itself, but complications caused from the disease. And most people pass 25 to 30 years after their diagnosis. Some treatments, there is no cure, but we do have treatments. Some treatments are medications. These medications have many functions, like reducing relapse rates, lessening symptoms, reducing brain lesions, and some block the movement of damaging immune cells from the bloodstream. We also have rehabilitative activities and equipment such as canes, braces, or walkers. These two, they help build strength in the muscles and bones, and they help improve the patient's state of living. It helps them do normal everyday activities like going to the bathroom by themselves, not having to depend on other people to help them with everything, and that really helps with their mental stability and their physical stability. And that's it. These are my resources that I've used. I didn't quite make it.